The question is that the grievances be noted, and I call the member for Fremantle.
Thank you, Deputy Speaker. The global pandemic has brought the fundamental importance of good health to the front of all our thinking. The value of good health in our own lives, in the lives of our families and in the wider community. We've been reminded that our individual health is not separate from community health, and we've been reminded of the ways that physical and mental and emotional well-being are intertwined. We've been given an opportunity to consider how health circumstances can be very different and more difficult and fragile for some parts of the Australian community, including older Australians, especially those in residential aged care, including Indigenous Australians and Australians living with a disability. I'm sure the circumstances we've faced together over the last 15 months and the circumstances we've all seen overseas have made us reflect with gratitude on the quality and accessibility of Australia's public health system, particularly on the expertise, skills and commitment of our health workforce, the doctors, the nurses, and all the staff who make our GP clinics and our hospitals function to such a high standard. As difficult as the COVID-19 experience has been and continues to be in many ways, it's undoubtedly been an opportunity to recognise and acknowledge the special features of Australia's universal public health system. The building blocks of that system include Medicare and the Pharmaceutical Benefits Scheme and the National Disability Insurance Scheme. And each represents a reform that was made in the name of increasing our shared national well-being. And each represents a reform delivered by Labor as part of our enduring commitment to that cause. Coalition governments, by contrast, have not only failed to imagine and create those kinds of reform, they've actively resisted them, and once they're created, sought to whittle them away. It is amazing to think now that Liberal oppositions opposed Medicare. In fact, Labor had to create Medicare, effectively, it had to create it twice, once under Whitlam and then once and for all under Hawke. In recent times, the Coalition has intentionally underspent funds allocated to the NDIS. Now they're seeking to bring in so-called independent assessments that will require participants to go back through the process of evidencing their needs without the benefit of the input of specialists who best understand their situation. And there's no doubt that the manoeuvre is principally motivated by a desire to reduce funding. It's designed to reduce funding. In a week or so, we're going to see hundreds of changes to Medicare benefit schedule items that will increase out-of-pocket costs and decrease access to many, many forms of treatment. Something like 1,000 different Medicare benefit procedures will be pulled from the schedule, altering the cost of hundreds of orthopaedic, cardiac and general surgery items, which could mean that patients with upcoming procedures will have to choose between cancelling or delaying life-improving surgery or being lumped with huge bills they had every right not to expect. Many of the patients affected will be those who have already copped massive increases to private health insurance over the past decade. Sadly, in the 8 long years of the Abbott-Turnbull-Morrison government, the cost of accessing healthcare has soared across Australia and in my electorate of Fremantle. According to the latest annual Medicare statistics that were revealed through the Senate estimates process just the other week, out-of-pocket costs for patients in Fremantle, East Fremantle and Coburn have risen 21% when it comes to seeing a GP, and a whopping 54% if you're talking about access to specialist care. In terms of the broader neglect of Western Australia as a whole, as a state, WA has the lowest rate of GPs per capita of all the states and territories, 79 GPs per 100,000 people compared to the national average of 96. We're also below the national average for aged care beds at 62.1 beds per 1,000 head of population compared to 75.5 nationally. And that number has seen a 23% decline since 2001. Deputy Speaker, we have to remember that the 2019 Morrison-Frydenberg budget included a measure to cut $359 million from WA hospitals over 5 years, which was a significant retreat from the previous Labor government's approach of sharing tertiary healthcare costs 50-50. And when you think of the Morrison government's stewardship of our health system as a whole, all those details make pretty grim listening. But they have to be put alongside the government's recent performance. In the circumstances of a pandemic, this government, our national government, has two crystal clear responsibilities: to provide and support an effective national quarantine system and to deliver a smooth, sensible, practical, strategic vaccine rollout. But we have seen none of those things. We've seen neither of those things. We haven't seen an effective national quarantine system, which is squarely the responsibility of the Commonwealth, and we certainly haven't seen a smooth or sensible vaccine rollout. The government's been entirely missing in action on quarantine. It's spent most of its time on that issue, criticising state governments, pressuring them to open up in the early part of the pandemic, haranguing them when lockdowns occurred, and doing nothing to take up its responsibility to fund and deliver quarantine around Australia that is fit for purpose. And we're going to need that more in future, I'm sure, particularly as we look to open up. The vaccine rollout has been an eye-watering shambles. Every passing week throws up more examples of how the government is apparently intent on sort of demonstrating how not to do a national vaccine rollout program. We never had enough vaccine options. That was pretty clear early on, and it's become super clear with every passing month. Pretty much all our eggs were put in the AstraZeneca basket, and we now face significant challenges as a result of issues that have arisen. Now, they could have been managed. AstraZeneca is still a very effective vaccine, and people should have confidence in the way that our public health experts have adjusted the approach to AstraZeneca to ensure that people get the benefits from it while having it administered to them on a safe basis. But when you've only got AstraZeneca and a trickle of Pfizer, it's no surprise that we still haven't got to 3% of our population vaccinated when many other like countries are north of 50%. We've never had security of supply. The government said we are top of the queue and said that they would guarantee this flow of vaccines. And from earlier this year, it became clear that that wasn't the case. Countries in Europe held on to vaccine that they didn't want to send our way, and we didn't get what we needed as a result. We've heard this week that Pfizer was in conversation with the government, prepared to deliver 40 million doses by January this year. They were prepared to work in partnership with us and make Australia essentially a demonstration, a model nation for the kind of global leading vaccine rollout. For some reason, the government decided to turn away from that. Despite constantly telling people that there has never been a supply issue and being very thin-skinned and wounded whenever that's suggested, both the state governments of Victoria and New South Wales have confirmed that they could vaccinate more Australians if only there was more vaccine available. And Lieutenant General Fruin, who the government has appointed to help get the vaccine rollout on track, address any number of the disabling practical glitches that have emerged, Lieutenant General Fruin is quoted today in The Australian saying, "We are still in a resource-constrained environment." That is kind of military speak for, we don't have enough vaccine. We just don't have enough vaccine. And as a result, we've seen when there was a breakout in Victoria, less than 10% of the aged care workforce was vaccinated. We still see drivers transporting aircrew who haven't been vaccinated. This is holding Australia back. It is holding our recovery back. It means that we will remain shut to the world for longer. It will mean that the economic consequences run deeper. Deputy Speaker, the COVID-19 pandemic has reinforced the foundational importance of good health and a strong health system, and it's shown the sadly inbuilt incapacity, I should say, of the Morrison government to grasp that essential point, to shoulder its basic responsibilities and to deliver even the ground level standard of administrative competence that people should be able to expect. Without question, our future well-being and our recovery from the pandemic rests on that approach changing and changing fast, but it's virtually impossible to see that happening under this government. They have failed. They have failed comprehensively and harmfully on aged care. They're failing on the vaccine rollout, and their plan is to weaken Medicare and to make life harder for those who depend on the NDIS. That is a recipe for hardship and inequality and suffering.